Hello, everyone, and welcome to the first ever PhRMA Foundation webinar on how to win a PhRMA Foundation grant. I am happy to see so many of you here today, and I suspect we'll see more trickle in. I am Amy Miller, president of the PhRMA Foundation, and it is my absolute pleasure to welcome you today. We have a special guest speaker who is an expert in value assessment, and many of his comments and mine will be general to all of the PhRMA Foundation programs. And then we will also drill down into the specifics of value assessment. I want to thank all of the applicants who have joined. If you've applied and didn't succeed once, please try again. If you're thinking about applying, I hope this video gives you great confidence in moving your application forward. And for those of you who are professors and deans, I hope you learn a little bit about our Mid-Career Award and find some interest there. And also recognize that we have funding for your students. And so please encourage your students to join. The PhRMA Foundation values integrity, innovation, and collaboration. With regard to integrity, all of our grant applications are managed under a secure portal. And our selection committee is half experts in their fields and half industry folks who work in the areas that we fund. Innovation. Across all of our different categories, our researchers, our selection committee members love picking high-risk, high-reward programs. They like funding things nobody else will fund. They're willing to take a chance. And we like to think the PhRMA Foundation is where we have a home for research that doesn't necessarily fit in other homes. And we also value collaboration. And this meeting right now is an example of collaboration. I'm here, you're here, and then we've asked one of our selection committee members, our former selection committee members, to come back and collaborate with us on an educational webinar that will be available for all of you to watch now and again and in the future. We fund roughly 40 of the roughly 400 applicants we get every year. We are nearly 60 years old, and over that history, we've funded over 110 million, we've given over $110 million to over 2,700 researchers at over 300 US-based organizations. And I do want to say that our awardees must be at US-based institutions, but they can be foreign nationals. We do allow foreign nationals to compete for our awards. What do we fund? You should be aware that we fund value assessment and health outcomes research. We also fund translational medicine, drug discovery, and drug delivery. And as we go through the next slide, you'll see a little bit of detail on those. And then broader information on value health outcomes. What's new? A lot's new. For over 20 years, we've been funding health outcomes research. And in fact, some of those folks who won those research awards 23 years ago are out now leaders in the field and are doing value assessment research. Also, the people who work on our study section have expertise, many of them, expertise in both areas. And we funded different types of researchers in each bucket, and by bringing these two together, we can fund a life cycle almost of a researcher. Now, I know these are a lot of things we fund, but again, we will circulate this video next week. Furthermore, we will post this checklist in a useful manner on social media again next week. So I'll give you a second to take a screenshot if you're ready to do that. And I'll move on to who we fund and at what level we fund. So I'm going to start with translational medicine and end up at value assessment, going around starting in the TM box. We fund postdoctoral fellowships and faculty starter grants in the translational medicine category. In drug delivery and in drug discovery, we fund pre-doc, postdoc, and faculty starter grants. And the levels are the same no matter what bucket you're talking about. And then for value health outcomes research, we just added a mid-career faculty grant. I should also note that we've expanded our faculty starter grant. It used to be for folks in their first 3 years of an independent professorship, but now it's the first 5. And if you are 5 to 20 post your last terminal degree, that's when the clock starts on the 5 to 20. And that's where our mid-career awards are going. The reason for those who may qualify for the mid-career award, I wanted to give you some preliminary thinking. This will be our first year when we launch our new program. This will be our first year with this category. And so it doesn't really have a tradition. The reason we considered it, though, is we found that we were getting very interesting applications in other buckets that didn't quite fit where they were going. And we realized there were some interesting programs from mid-career folks who wanted to do something different. They wanted to turn their research on its side, or they wanted to gather some empirical data in a way they haven't done so before. And we wanted to give that space because this field is growing extremely rapidly. And this field is evolving extremely rapidly. And to be completely honest, the talent devised by people in the value assessment health outcomes space, that talent is in great need. And I'm not sure right now we're keeping up the need on the industry side with the talent coming out of grad schools. And so I hope we can seed and fund this whole entire area. So here are some of our recent grantees. Half of our grantees over nearly the last decade have been women, and about half of our awardees over roughly the last decade have been people of color. I'm very proud of this diversity. I will say that I would like more geographic diversity. We do have a little, coastal issue, middle of the country doing fine. I'm from the Southeast, would love to see the Southeast represented. We don't fund a whole bunch of folks in the Southwest, would love to see you represented. And again, in some of those research universities who are not in the usual places, I know you're on this call, I really hope you'll consider applying. So enough about the foundation, let me introduce our guest speaker. For this audience, I'm not completely sure Peter Neumann needs an introduction. He's a pretty famous director of the Center for Evaluation and Value and Risk in Health at Tufts Medical Center. He is very well known and even wrote the book on how to price medicines. Can be yours, available on Amazon. And what's most important for you to know, though, is 5 or 6 years ago, he helped establish the PhRMA Foundation's Value Assessment Working Group and establish our categories and how to fund what research we're going to. He's no longer on our committee, so he is free to tell his secrets. And I've told him, Peter, you're free to talk about whatever you want. You're not on the committee anymore. And so without further ado, here's Dr. Peter Neumann.
Well, thanks so much, Amy. It's really a great pleasure to be here, honored to be invited. And thanks to you and the foundation for all the great work that you've done over the years. Your research support really has funded countless researchers and advanced the field in so many ways. So thanks to you.
Thank you.
So when Amy first approached me to give tips on grant submissions, I have to say I did wonder if I was the right person. For one thing, I am a health economist, and a lot of the foundation's work goes to drug discovery and delivery and translational medicine, although of course they do have the value and outcomes piece. But she assured me this was a general talk and that my remarks would be relevant. I also wondered, though, if I'm the best person. I've had my share of grant rejections, so there is that. But I have had a few things accepted, and perhaps more importantly, I was on the review committee, so that gave me the opportunity to really review dozens and dozens of grants over the years. So with that as kind of context and background, I'm going to share my reflections. This is one person's reflections, and I'll emphasize one person because as I sat around the review committee, I was often struck by the variation in judgments that the review committee would make. Sometimes I would think a grant was great, and colleagues would think it needs a lot of improvement, and vice versa. So let me get into my remarks. I just have a few slides that, and I think there's a bit of a delay here. So let's just see if I can advance. Yeah. So I've divided my observations and tips into two categories. First, I'm going to talk about what I'll call the science. You know, the heart of these grant submissions, of course, is the science, the work plan. But I'm also going to talk about what I'll call the process. And the process, I mean grantsmanship, you know, things you can do to enhance the submission around the science. Of course, we'll start with the science, and that's the most important, but there are other things I think you can do. So let us start with the science. And here are, this is a distillation of 8 tips that I have come up with. So, and the context of this is, I, like the other reviewers, you know, we're seeing lots and lots of grant submissions. Often we're reviewing these at home at the end of the day, then we do meet in person. But, you know, it's the end of a long day. We have a large collection of grant submissions to review. I'm looking, whoops, that was too fast. There we go. One, inspire me. And what I mean by that is I'm looking for really creative ideas and ideas that are different than what I'm seeing elsewhere. And I want a great idea is, of course, it has to be interesting, but it also has to impact the field. So that's very important. It could be interesting, but not impactful. But I'm looking for differentiators, and I'd love to be inspired by the idea. So as part of that, how does the research build on existing research? Now, some of these may be straightforward and obvious, but sometimes the grant submissions don't really help me here. The idea might be good, but I'm in need of some context. I really want to know how this is going to build on previous work. So, you know, ideally tell me that, and tell me that quickly if you can. And then really importantly, how will the knowledge that's created from this research solve a real world problem, impact the field? It's not enough to have a great data collection strategy or great analytic techniques. You know, those are necessary, but not sufficient. I want to know how the work will advance the field. So, you know, please tell me that as well. Be specific and detailed in your work plan. Again, I appreciate this is probably an obvious statement, but you know, I really want to know what you're going to do. And sometimes we use this word hand wavy. Don't be hand wavy. Now, hand wavy is when you're waving your hand at something that you will do in your research. I will find, you know, 500 people and survey them. Well, okay, but who are these people? How are you going to find them? How are you going to think about, you know, the generalizability of your research? Tell me that, and tell me, you know, in detail. And of course, you have word limits, and we're all very aware and appreciative of those word limits. Nonetheless, use your space wisely to tell me specifically how you will accomplish your tasks. Then convince me that you can actually achieve your goals. Now, you know, ideally, you've done preliminary research. Now, this is tricky, especially for people starting out in the field. If you're a pre-doctoral student, even if you're, you know, later on in your PhD studies or you're a junior faculty member, often this is new work. How can you possibly have done work before? That's an old chicken and egg problem. Nonetheless, maybe you've done a pilot study. Certainly you've thought about the research and, again, convince me that you can achieve your goals. And again, ideally, you've done some preliminary work that really helps convince me of that. Be realistic. Again, all of the review committee members are aware of limitations of research. Most of us are researchers and are keenly aware of limits and practical realities. So that's fine. Tell me and be honest, and don't be too lofty that makes me think, wow, this is a good idea, but not really practical. And finally, look closely at the foundation's priorities. Again, I realize this may be obvious, but sometimes the submissions are really pretty good, but they're out of the categories that the foundation is prioritizing. When I was there, the foundation, and probably still, is interested in issues around preferences and patient-centered research and equity and things like that. So, sometimes the submissions would be, as I mentioned, really good, but just not hitting those buttons. Okay, just a couple of examples that I chose that I liked as I was looking at some of the previous award winners. This is one: patient cost sharing thresholds for high and low value care for a value-based formulary. I like this topic because it tied patient preferences with data collection with a discrete choice experiment, which is a particular methodology to elicit preferences, with an actual important policy, a value-based formulary, and really trying to understand how to link preferences to formulary policies in terms of the levels of cost sharing, done by an experienced investigator who had done work in this field in the past. So I thought that was a good example. This was one on the fear of contagion in COVID-19 care. Obviously, COVID-19 care is a huge topic. This issue of how people think about the fear of contagion, which gets to the value of strategies, even for those who may not get COVID, there's real value in having new therapeutics. We all feel maybe a little bit better because we know if we get COVID, there will now be therapies to treat us. We certainly are better off with vaccines and so forth. But this was a study to quantify those preferences, again, by an experienced investigator. So that one made it through. This was a study on the value and challenges of older adult-specific clinical trials by a pre-doctoral student. And the issue here is that many of the clinical trials don't recruit and accrue older adults. It's a long-standing issue, but this was a study to try to collect some data, or analyze some data rather, to predict accrual patterns for older adults in clinical trials. I thought it was a very good idea, and it got funded. And just a final one: estimating the social welfare gain from biosimilar entry in the US. Biosimilars are an important topic. This study was going to predict biosimilar uptake at US health payers across the country. So really quantifying that uptake and then quantifying the consequences in terms of welfare gains. This study actually used a database that my center collects, although I was not involved. This was approved after I left the committee, so there was no conflict there. But I thought it was a good study, and it did get funded. Okay, so let me just turn to some what I'll call process issues, and then look forward to your questions. And again, by process, I mean grantsmanship, things you can do. And here's some things that occurred to me. Keep your audience in mind. And again, that's obvious, but what I really mean by that is the review committee is experienced, knowledgeable. So presume the audience has knowledge. don't tell me in the first paragraph or the first sentence that drug costs are rising or that drug prices are, on the national agenda or that health costs, are increasing. We know that. Really, ideally, tell me in the first sentence or two or first paragraph what you're going to do, why it's important, how it builds, how it will be impactful. Often, when I review grants from my own center, I cross out the first paragraph and I say, let's start with the second paragraph, because that's really telling me what's new here, what I want to know, and just presume people know that costs are rising and such. Okay, this is what I mentioned earlier. I've been reading 18 applications. Anything you can do to help me differentiate will be very much appreciated. Put yourself in the mind of the tired, but committed and eager reviewer. Help me out, and I have some more suggestions on this topic. One is strategic use of white space, subheads, bolds, underline. Sometimes the grant submissions are so detailed with small font, every piece of the screen is covered because the grant person submitting wants to convey so much knowledge. I get that, but it's sometimes better to pare back a bit. Give me a space between paragraphs, give me something underlined and bold, and help me take my eye to the important part of the page, things like that. Often they're little things, but I think they can actually be helpful. Again, we've talked about the science. This is the enhancements after that. Succinct sentences. Often sentences meander and are wordy, and there's a lot you can do to be succinct. I would have a colleague read the grant submission carefully and think about that and help remove words if you can. Not to change meaning, but just to really get at the essence of the sentences more quickly. Part of that, I think, is active tense. There's some disagreement in the field about this, but I'm a big believer in active tense. We will collect data in the following manner. We will run a regression to do the following, things like that. The regression will be run. That's a passive tense, I think, is harder on the reader. The reader, in a way, is looking for the subject of the sentence. We will do the following. I would highly recommend active tense. I think it helps. Finally, letters of support and partnerships. Just a word on this, at least from my perspective. Letters of support are important. Certainly as a reviewer, it could be a nice differentiator. I would certainly read them. The trick here is sometimes the letters were from very well-known people or people of prominence, the president of the university. I always kind of liked when I saw the president of the university writing a letter, even as I knew the president of the university probably doesn't know this person or has read the grant. It displayed some measure of resourcefulness and ambition and such. But I also want to see the letter from the person who actually has worked with the potential grantee, the mentor, the fellow scientist, somebody who could really tell me that this person can do the job. So, maybe there's two letters, one from and it doesn't have to be the president, it could be the department chair or the, somebody, the dean or whomever, but that was always my take. Nice to get the big name, but also very important to get the person who's really going to vouch for you as the grant submitter, that you could do the job and you're the one who should get the award. Finally, similar, I guess, on partnerships. Sometimes the partnerships seem very relevant with people who would actively engage in the research. Sometimes the partnerships seemed a bit of window dressing with a name who may not really work on the grant, but the grantee thought it would be useful to have them. Obviously, there's subjectivity in how these things will be reviewed, but just some thoughts to consider. And then a final word on just a few other elements, and these are mostly kind of stylistic or even cosmetic, but I thought also important. well, very important, double check you're following instructions. That's always good. Be realistic about timelines. You know, again, the researchers on the committee appreciate it takes time to collect data, and you know, we're often subject to what some call the planning fallacy. You know, we think we can do a lot more in time than we can, so be realistic. Ensure the budget's realistic and appropriate, and ensure your proposal's free of typos, misspellings. That shouldn't be even maybe on this because it's so obvious, but we do see sometimes proposals that get in at the end with some of these issues. So with that, I will thank you, look forward to your questions, and also thank you, Amy, for mentioning the book, which is out and on Amazon.com.
Thank you, Peter. So for those watching, please put your questions in the Q&A, and I hope and assume I see them and we'll address them. But Peter, before the Q&A populates, I would like to ask, I liked that you had some of the studies that you remembered funding that you liked. That was great to see. What do you think the field needs now? Or when you were on the committee, what project did not come your way that you wished would have come your way?
Yeah, you know, we as I mentioned, we saw dozens and dozens of studies, really spanning a wide range of topics. I guess I would like to have seen a little more maybe on some of the key policy issues, you know, given the foundation's priorities, say in preferences. I mentioned the value-based formulary paper that I liked. You know, tie the research to real-world policies, and it's sometimes hard to do. But I think that's, you know, one area. I don't know, another one just that pops in my head, there's a lot of work around pricing dynamics and what we sometimes call life cycle pricing. You know, how pricing changes over time with the entry of generic drugs, with the entry of biosimilars, with the entry of competitors. You know, I think there's a lot of interest, and I don't know if that's currently the foundation's priority, but these kinds of you know, real world economic dynamics, which gets to valuation issues too. You know, when we do the value assessments, should we include these price dynamics? Is a big issue. Well, usually we don't. So I think there's really room there to do some very good research.
That's a great answer. And to the point of the direct connection with policy, I think the IRA passing this year and just seeing all of the thought pieces on how that bill is going to be, how that law is going to be implemented, demonstrates very clearly the import of this entire field. And by making that direct tie, you're giving the power to the researchers to make the tie on how their research or how their field of research impacts policy, rather than policymakers interpreting it possibly rightly or wrongly.
And you know, again, my background and experiences in the outcomes and value assessment. I'm sure there are many good areas on the drug discovery and translation side. I just am not the one to advise on those.
Of course, we're going to get somebody from those spaces too. You were first though. Although we give money in all four buckets by far, the most of our resources do go to this bucket. So we started off with you. The other question is the field. I've always understood comparative effectiveness research and value assessment research. I've been in that field, that aspect of the field on the policy side for 15 years. Since coming to the foundation over a year ago, it's occurred to me that the need for people in this space is exponentially growing. So industry wants to hire, academia wants to hire, think tanks wants to hire. CMS is hiring actively our professors, your professors in this field. So what do you think the next steps are for the field of research, since there is so much need for the talent? Where can the talent focus their researchers? Which may be, you know, if you're a pre-doc right now, think about answering this question for that person's career.
Yeah. Well, first, I agree with you. It's a thriving field. Demand is growing for talented people. That will likely continue. And all the people you mentioned, or the places you mentioned, industry and academia and government, CMS is ramping up their staff and on and on. I think there's always a great demand for people who are well trained and have good data science skills. The databases continue to improve. The analytic techniques continue to advance. What we're doing now with linking databases and using some of the machine learning techniques and such, all of those are being applied in new ways. We have data coming now from, digital sources and wearables, and, not to mention just better data capture in the traditional places and the electronic medical records. All of that gives a wealth of possibilities for researchers. As I go to the scientific conferences, just to pick one topic, infectious disease and future pandemics, potential pandemics, there's so much research that's important in the valuation space. How do we value vaccines? Just to pick out one topic. You could argue these vaccines for COVID have really created, billions and billions of dollars of value, maybe trillions even, as people have been able to go back to work and kids back to school. There are lots of valuation issues there. How do we value spillover effects, that the value to people who are not even getting COVID, but they're able to go back to work because they have the vaccines, and I mentioned they have the therapeutics available. How do we even think about that? How do we collect data to measure that? I think those are, and we can go on. I mean, in other disease spaces, there's a lot of important work to be done in rare diseases, in cancer, in antimicrobial resistance, on and on and on. I think these sort of spillover effects, if people can capture those and think about how we measure those in terms of value, I'm sure there are others, but those are some that come to mind.
I think that vaccine question is very interesting and also has implications for the future of mRNA therapeutics, which the next may well be a cancer treatment, a cancer vaccine, and a cancer cure. How do we value a trifecta from one therapeutic?
Yeah, no doubt. And, just to pick another issue that's critical is equity, as the foundation has prioritized. There are equity issues in all of these topics, but, the vaccines, who's actually getting them, who has access to them, who has knowledge about them, some of the variation we're seeing in uptake around the country, there's all kinds of important issues there.
Absolutely. We do have a question in the Q&A, and I think it's a foundation question. Do research questions need to be focused on pharmaceuticals? The answer from the foundation is absolutely not. We will fund comparative effectiveness research, health outcomes research, and value assessments of things that are not therapeutic. But I don't make the decisions. Peter, what have you observed in your grant reviews?
Yeah, no, same. We reviewed and advised to approve projects that were not pharmaceutical related. They were disease related. We saw a lot of submissions around, say, mental health, depression, collecting data on people with depression and to what extent do they go back to work after they're being treated, things like that. Now, there were maybe medications implied, but there were no specific medications under study. The study was about, management and productivity gains with depression. And sometimes perhaps it was not even a pharmaceutical intervention directly related. There was, you might consider it sort of some basic research around value assessment and health outcomes. I'm trying to remember off the top of my head, or if I saw one, but it's probably not exactly what I was thinking about, but I mentioned the recruitment of older adults into clinical trials. That's a general issue. There wasn't any specific drug involved. It's just a general issue for randomized controlled trials. And there probably were others.
Absolutely. And the foundation does like to support foundational issues in health as well as specific issues in health. we're a pretty flexible group. Again, this is a place to come if you can't find a really good source for your research. And also if you're creative, we'd love to see what you've got to offer. So
I'm thinking one of my colleague here at Tufts received from a foundation grant to develop a quality checklist for cost effectiveness analyses. That is applicable across a wide range of interventions, public health programs, procedures, diagnostics devices, as well as, so there's another example.
Yeah. Personal desire of mine is more on the value of diagnostics, but that's a personal opinion, not a foundation opinion, I should say. Yes, the recording will be shared via email next week. I'm glad you're enjoying the presentation. And Peter, I'm reading another slide, another Q&A question. How much the foundation appreciates grant applications that focus on artificial intelligence, machine learning, and health outcomes research. Thank you for your expert opinion, Peter, really helpful in your tips. So that sounds like a very interesting question, Peter. I'm not sure if we've seen artificial intelligence or machine learning in HOR research yet, but it does sound interesting. And to the point that it may be new for our committee, you should just know, our committee is our committee, but if we need a type of expertise, we will find it. And so if we get, we do have AI and machine learning experts in the other buckets. And if we need someone to review a grant, we will find that talent and bring them into the review process. So yes, I'm open to it. Do you think the committee would be?
Yeah, absolutely. Although I will say, and if you would, whatever you're doing, help the committee in terms of translating the work into, something a knowledgeable general researcher reviewing could understand. So, we see things sometimes that we're not experts in, to be sure, but, help us and translate. I remember one review committee where a comment by one of the reviewers was, I have no idea what this person is talking about, but it sure sounds important, so, but I don't think that was reviewed very well because they didn't help us. So we may not be experts in machine learning and artificial intelligence, but we certainly know something about data and analytic techniques. So help us.
In terms of process,
and to your point, there certainly could be ways to find experts who are much more knowledgeable.
I don't remember which committee it was, but one committee had a really beautifully written proposal. It looked perfect, except for the research had been done and solved about 15 years earlier. Right. So fortunately, we had some experts on the committee. And this has happened twice, actually, now that I think about it. So these are smart folks. And so make sure you do your research to make sure your hypothesis hasn't already been tested. Do you also fund drug delivery and formulation development research? Why, yes, we do. We're at the end of our drug delivery cycle, though. We had our committee meeting yesterday, and so it will be roughly, let me say, 9 months until we do another open call. And absolutely, we are interested in formulation development research, both on the biology side and on the material sciences side. So I hope that answers your question. With regard to specific disease, the committee just met yesterday, so this is fresh. They don't care if it's disease specific or if it's pan disease. And yesterday, they equally weighted programs that did both. And they also did say at the end of the meeting, they wanted more pan disease protocols, applications, and this was the word, gizmos. So if you've got some new ideas in that space, please do apply. You've got 9 months to prepare your application. You're welcome. Peter, I don't see any other questions. Would you like to make closing comments?
Well, first, thanks again for inviting me and for all the great work that you are doing. There's on the call here today and out there in the field, a lot of great young people and mid-career people doing really important work. So, this is just a great opportunity. And I hope this can help at whatever level of improving the grant submissions. But, I look forward to seeing the fruits of all this labor as they as the research comes out and goes into the journals and impacts the field. So really, thanks again to all of you.
Great idea for the next webinar, journal editors talking about publications of these things. Well, I want to thank the audience, and Peter, thank you so much for your time. Again, this will be circulated, the recording, next week, and also that checklist of work that we're looking to fund specifically will be circulating as well. Thank you all for joining, and if you have additional questions, just go on our website, pharmafoundation.org, awards, and you should find info at pharmafoundation.org there as well. So thank you for your time and have a good day.